Hello, I'm Hannah McPhee and I'm a consultant anaesthetist at Poole Maternity. Anaesthetists are doctors who are specialised in pain relief and taking care of patients who are having an operation. Consistently, more than 40% of women at Poole Maternity have a procedure by an anaesthetist. There is an anaesthetist available to provide pain relief at all times, and we aim to provide pain relief services within 30 minutes. However, overnight and at weekends there's a chance that the anaesthetist may be busy in theatre, taking care of another woman, and therefore there is sometimes a delay to providing pain relief. Some of the pain relief options are only available in certain locations, so there may be a delay in transferring you to a place where certain options are available. Today, I'm going to start with talking about the medicine-based pain relief options for labour, and then talk about anaesthetic care in theatre, then move on to a few specific situations. You may already have some idea about what pain relief you'd like to use during your labour. It is normal to require different types of pain relief, and it can be hard to plan for this before you experience labour, and each labour can be different. Gas and air can be provided immediately at all birthing locations and does not require an anaesthetist. It provides moderate pain relief. It is a mixture of oxygen and nitrous oxide, which is breathed in and breathed out through a mouthpiece. The key to this method is to use the right technique. You should start breathing the gas in long, slow breaths as soon as you feel the contraction coming on, and continue with it throughout the contraction, so you have plenty on board by the time your contraction is at its strongest. When the contraction is finished, take the mouthpiece out of your mouth and breathe normal air. Gas and air can make you feel sick, but usually, if you use it beyond 10 minutes or so, the sick feeling goes away and you can still get the pain relief benefit. You can have anti-sickness medicine to help too. The gas and air can make you feel spaced out and giddy. Gas and air doesn't have any effect on baby. Pethidine can be provided at Bournemouth, Dorchester and Poole, including on the Haven, and does not require an anaesthetist. It provides mild pain relief but can help you to feel less anxious. Pethidine is a morphine-type medicine which is given as an injection, usually into the thigh, alongside anti-sickness medicine. Once the injection is given, it takes around 30 minutes before it starts to work. The effects last a few hours. Like other morphine-type medicines, Pethidine can make you feel sick and spaced out. Following Pethidine later on in labour, baby may be slow to breathe and may be drowsy and find it difficult to feed at first, and therefore your midwife will advise you whether or not Pethidine is a good option. Remifentanil is only available at Poole Maternity in delivery suite. It works differently for different people, but you can use gas and air at the same time. It is a strong morphine-type medicine which is very short-acting and lasts about the same time as a contraction. It is given into the vein through a small cannula or drip, which is a plastic tube which stays in the vein, usually in the hand or wrist. You press a button when you feel the contraction, and a pump delivers a small dose of the medicine, which should last about the same time as your contraction before being broken down in your blood. Like other morphine-type medicines, remifentanil can make you sleepy or feel sick. Because it is a very strong medicine, it can make your breathing slow or shallow. Your midwife will need to stay in the room with you at all times and monitor your oxygen levels. If your oxygen levels drop, you may need to have extra oxygen, which is given through your nose, or you may need to stop using remifentanil. Remifentanil may be a suitable option for you if you don't want to have an epidural, or for some reason epidural is not suitable for you. Remifentanil can make babies slow to breathe at first, although this is not common. Epidural is a procedure to insert a small plastic tube into your back. The tube can stay in throughout labour and allows us to give you medicine to keep you comfortable for as long as needed. After your baby is delivered, the tube is simply removed by pulling it out, which is not painful. You will need a cannula in the vein and a drip of fluid. You will need to sit up and stay still while the procedure is being done. Once the epidural is working, you will need a catheter into your bladder. You may be able to move a bit in bed or in the room, but your legs can become weak and then you would need to stay in bed. The procedure takes about 20 minutes to prepare all the equipment and insert the tube, and then about 20 minutes after that to get working. When they work well, they provide excellent pain relief for labour. Sometimes the numbness can be a bit patchy or one-sided, but often this can be fixed by changing your position or giving extra medicine into the epidural tube. Occasionally, it doesn't work at all and needs to be taken out and replaced. In general, epidurals don't have any effect on baby, although your blood pressure can drop, which could indirectly affect baby if it wasn't treated. If you want to know more detail about the pros and cons of epidurals and the specific chance of any risks, please go to labourpains.com. Around 30% of women who deliver in Dorset's maternity services have their baby by caesarean section, and some need to come to theatre to have help delivering their baby vaginally, either using forceps or ventouse, which is a suction cup. Occasionally, women need to come to theatre for help with delivering the placenta or for suturing of some tears. We always aim to keep you awake for the delivery of your baby if safe to do so. The whole time you're in the operating theatre, an anaesthetist will be there with you, and their job is to keep you safe and comfortable. If you already have an epidural in, which has been working well in labour, this can be topped up with stronger medicine to change it from a pain relief epidural to an anaesthetic epidural. We would aim for you to be numb up to the level of your nipples and confirm your numbness level is enough with an icy cold spray before starting any procedure. This takes around 20 minutes. If you don't already have an epidural in at the time you come to theatre, we would usually do a spinal anaesthetic. This injection is in a slightly different position in your back from an epidural. Nothing stays in your back, and once the injection is done, you will lay down flat and become numb up to the level of your nipples in around 10 minutes. Again, we would confirm this with icy cold spray before any procedure starts. The numbness lasts around 2 hours and then starts to wear off. Occasionally, it may not be safe to do an injection in your back because of medical problems which you might already have or which might develop through pregnancy or labour. Occasionally, we need to deliver your baby very quickly for your safety or baby's safety. These situations may require general anaesthetic, which means going off to sleep. Additionally, at any point during your time in theatre, it is always possible to send you off to sleep if needed. If you were to have a general anaesthetic for any reason, your partner would not be able to stay in theatre. If you are overweight, this presents a few challenges for labour and delivery. You are more likely to need help delivering your baby with forceps or caesarean. If you need an epidural or spinal anaesthetic, it might be more difficult to insert. As I mentioned before, occasionally it is necessary to do a general anaesthetic or put you to sleep to deliver your baby. If you are overweight, this is a high-risk procedure, so we want to really try to avoid this if possible. For this reason, you might be advised to have an epidural early in labour. This means that we can do it when your contractions are spaced apart and you're more able to stay still, which makes it more straightforward. If you have a working epidural, even if you need to go to theatre in an emergency, we can top it up, which can avoid the need for general anaesthetic. There is no evidence that epidurals or spinals cause long-term back pain. In fact, these procedures are often used to treat back pain. Pregnancy and delivery can unfortunately cause musculoskeletal problems, including back pain. If you want more information about pain relief options for labour and delivery and anaesthesia for caesarean section, labourpains.com is a really useful website which provides detailed information which you might find answers your questions. It includes a leaflet comparing different methods of pain relief, as well as information sheets in several different language translations. If you can't find the answers you need on labourpains.com, please do talk to your midwife. For me, it's really important that you have as much information as possible about what pain relief options are available to you for your labour and delivery, and that you don't feel scared to ask for pain relief when you need it. Thanks for listening,